Learning you have chronic hepatitis C can be very frightening and cause a variety of emotions. Don't allow the disease to define you. It is important to take charge of your chronic hepatitis C and work with your healthcare provider to manage it in the best possible way. Empower yourself with the knowledge by building a strong and open relationship with your doctors and nurses. This will help you to assure yourself the best treatment possible, stay on top of certain treatment side effects, and feel more comfortable talking about your symptoms and side effects. Some helpful ways to establish and build a relationship with your healthcare team include the following. Always provide accurate information about any symptoms or side effects you experience, including severity or changes. Tell your healthcare team about all the medications you are taking, any allergies you have, and your dietary habits. Your nutrition is a very important part of your overall treatment. Ask questions that arise concerning chronic hepatitis C, the management of your health, and anything else. Keep an accurate diary of symptoms, side effects, and test results to keep track of your health between visits with your healthcare provider. You may not want to tell certain friends, family members, or coworkers that you have chronic hepatitis C. That is a decision only you can make. If people are not at risk of coming into contact with your blood, you may not consider it important that they know. However, it's usually easier to deal with a difficult situation if you have support from those who care about you. You might need someone's help staying on track throughout your treatment, or you may want someone to remind you and encourage you to keep your lab and doctor's appointments. Also, having someone in your life to learn the rules and guidelines of treatment along with you can make it easier to remember them. If you don't want to discuss your chronic hepatitis C with the people in your life, consider joining a support group where you can talk privately with other people who have the disease. There are a number of steps that you can take to help manage your chronic hepatitis C, and the first step is to learn as much as possible about it. Before each visit to your healthcare provider, you might want to prepare a list of questions to ask, and then during your visit, write down the answers he or she tells you. Bring the diary you keep of your symptoms and side effects. It may also be helpful to bring a trusted friend or family member along to provide support when you visit your healthcare provider, if that's possible. You might find it useful to keep a healthcare file with copies of your treatment records and lab reports. You may also wish to consider some of the following suggestions. Take your medications exactly as prescribed. If you're planning a trip, it is a good idea to carry a copy of your prescriptions with you, just in case you need to refill them. Also, remember to keep your medication in your carry-on bag or purse and not in your checked baggage. Try to develop a routine for taking your medications. Make sure that you tell your healthcare providers about any other medications you are taking, including herbal supplements, because some of these may affect your liver or how your chronic hepatitis C treatment works. Try to eat a healthy diet with fruits and vegetables, lean proteins, and whole grains. Drink plenty of water. Don't drink alcohol or use drugs. Both will damage your liver, and if you use IV drugs, you could catch another type of hepatitis or even HIV/AIDS. If you need help to stop drinking or using drugs, your doctor or nurse can help you find a support group, such as Alcoholics Anonymous or Narcotics Anonymous. Get vaccinated against hepatitis A and hepatitis B. Exercise if you can. Exercise may help with the symptoms of tiredness and depression. The easiest way to exercise is to choose an activity that you enjoy. Even walking may help. Make sure to check with your healthcare provider before you begin any exercise program. Pay attention to your emotions. Many people with chronic hepatitis C and other illnesses experience times of depression. This can be due to difficulty coping with their diagnosis, with the symptoms of their illness, or with the side effects of treatment. Depression may be treatable. Remember, chronic hepatitis C is a contagious disease that is spread through the blood. So it's very important that you not only look after your own health, but that you are aware of the following ways you can avoid spreading the disease to others. Tell anyone who may come into contact with your blood that you have chronic hepatitis C. They can use gloves and other ways to protect themselves. Don't share toothbrushes, nail clippers, razors, or other personal care items. Carefully throw away anything that might have your blood on it, such as tissues, swabs, and tampons, and wash your hands after doing so. Clean any cuts or scratches you have and use bandages to cover them. Use condoms with spermicides as one of your 2 effective forms of birth control, and avoid sexual activities that could cause bleeding. Don't give blood. Don't share needles or other drug paraphernalia. Go about your life as normally as possible. You can't spread chronic hepatitis C through casual contact or hugging, kissing, or sharing a drinking glass.